A heart transplant takes about 4 hours. In 4 hours, you somehow go from having your own heart beating in your chest to having someone else's heart beating in your chest. Can you imagine that? Hi, my name is Stephanie Dalmer, and my project is about breaking barriers in communication, developing a graphic novel to educate and motivate teen heart transplant patients. I have to begin by acknowledging co-authors Faye Murdoch, who helped with ethics, Jesse Thomas and Sean Caulfield, my amazing artistic supervisors, and Dr. Simon Urschel, who initiated this project and cares so much for his patients. So getting an organ transplant can be life-saving therapy. However, patients are left with strict lifestyle guidelines, taking meds to suppress their immune systems, drinking liters of water, being careful about germs, staying active, and avoiding risky behaviors like smoking and drinking. An info package that patients take home explains that a transplant is about swapping a fatal or unmanageable diagnosis for one that is manageable. It's not a cure. Out of all ages of transplant patients, teenagers have the hardest time adhering to the post-transplant guidelines, and their rates of rejection and organ failure are up to 10 times higher than that of other ages. No strategies have successfully addressed this, and teens tend to show short attention spans in conversations with parents and healthcare providers. So, the goal of this project was to create a new knowledge translation tool to try to educate and motivate teenagers to take increased ownership of their long-term health. This is where the idea of a graphic novel comes in, an age-appropriate, visually appealing tool that combines images and words to form a narrative that's both engaging and specific. So the plan was to start with interviews, having conversations with teen patients, their parents, and healthcare providers. We then analyzed the results, developed a storyline, wrote a script, drew the images, and printed the novel. The next step for us is to have the graphic novel evaluated on its quality, appeal, and relatability. So let's start with the interviews. After doing my own initial research about post-transplant guidelines, I assumed that the biggest concerns for teens would be needles, so many doctor visits, and especially the side effects of the meds, hair loss, acne, and weight gain. Teenagers' worst nightmare, right? Wrong. To my surprise, patients often claim to be used to most aspects of the post-transplant lifestyle. So what did we miss? By reflecting on conversations again, we discovered that a common theme in post-transplant life that we had totally neglected in our questionnaires was conflict with nagging parents. Interviews with healthcare providers confirmed that this could be an issue. Parents of young transplant patients have to be the ones at the beginning, giving medications and water and governing the lifestyle of their child. The big challenge is helping teens transition into taking over that governing role and maintaining the appropriate lifestyle. Healthcare providers also specified the lifestyle and health choices that were crucial for teens to adhere to in order to look after their new organs. You can see them there, taking meds, drinking enough water, and then down at the bottom, even specific things like not eating grapefruit. Finally, our interviews with parents. Parents expressed frustration that their teens were not taking their disease seriously, and they really hoped a graphic novel would be able to help their teenager to understand the consequences of their actions and give them some perspective. So as we prepared to move into the story writing step, we were hearing these three voices from the interviews. That there were some important lifestyle details that patients needed to better embrace. That they needed some better perspective, but also that teens had already heard all of this and were tired of being nagged about it. So we determined that subtlety would be key to avoid teenage mental blocks against instructional conversations or texts. As we moved into phase 2, we weren't going to make an information pamphlet, we were going to write a story. We'd asked teens their favorite movies, and the common themes were action and humor. So we jumped into developing a story that was adventurous and humorous and not preachy, that could exist on its own as a good story, and still addresses the concerns emphasized by the parents and healthcare providers. So I'm pleased to present The Cure. We chose this title as an elbow nudge to parents who are familiar with the band, but mostly it's an ironic reference to one of the themes in the book, that transplant is an imperfect cure that's still worth fighting for. So now I'm going to quickly take you through the story, show you some of the artwork, point out where we incorporated what we learned in the interviews. Just so you know, all of these pages were designed in my sketchbook, penciled in, and then inked with pen. And we left the novel in black and white because we like the aesthetic and the clear communication, and it's also much cheaper to print. So the story takes place in Edmonton, 10 years in the future, when a woman named Professor Bracken manages to mutate earthworms to live forever. The main character is 16-year-old Alex Colby, who we find out has had a heart transplant when he was 6. Now, early in the story, he's already experiencing conflict with his mom and her exaggerated nagging. So thanks to a fire at Professor Bracken's lab, the immortal worms escape into the Edmonton soil and start killing all the plants in the river valley and the surrounding farms. So for the rest of the story, the characters are fighting against this unseen enemy. And this was meant to subtly suggest a respect for a hidden disease, for a problem that might not be visible now, but has consequences. So in the hubbub, Professor Bracken disappears and Alex and his mom have another big conflict that frustrates Alex enough that he decides to run away on a journey to find Professor Bracken and with her try and save the city. Now, we wanted to normalize the post-transplant lifestyle for teens. Here's a place where we're able to do that. As Alex packs his runaway bag, he includes the necessities like his medication, plenty of water, and then even things like bug spray and sunscreen. So even while he's rebelling, he's taking care of himself. Now, through a series of events, he ends up finding the professor living in a cabin in the woods with a blooming greenhouse. He's surprised that her plants are doing so well. She explains her goofy maintenance strategy and then explains that even though it's an imperfect cure, it's still useful and beautiful. And this is a crucial idea in the book, responding to parents' concerns that teens need better perspective by subtly suggesting, through the theme of an imperfect cure, that health, even imperfect health, is worth fighting for. Now things get exciting. Alex and Professor Bracken accidentally uncover a sinister plot, and they end up having to escape from a gun-waving enemy through a secret tunnel under Bracken's cabin. Now in the tunnel, Alex discovers that Bracken has had a heart transplant too, and so it's like she becomes a mentor figure for him from this point on. Alex is able to admit to her his frustrations with his mom, with a post-transplant lifestyle, and Bracken is able to directly speak into these things with a different voice than a parent or healthcare provider. She speaks as someone who relates with his experience, and from that place encourages him to take care of himself in the same way that she did. Bracken's secret role in the story is to effectively communicate to teens that it's health, not rebellion, that frees us to do what we want in life. Now, I don't want to spoil the rest of the story. There's some close calls, some quick thinking, some drama, possibly a happy ending. But to address parent nagging at the end, Bracken is dropping Alex off at home when she says, "My expert advice on dealing with nagging parents? Beat him to it." So when Alex's mom is about to nag him, he lists all of the lifestyle requirements that he did follow that day and leaves her speechless. She has nothing left to ask except if he wants a sandwich. Now, we wanted to leave teens with a strategy to suggest that they can beat nagging by taking ownership and making it their thing instead of their parents' thing. So those are just some snapshots of the super abridged story. It's critical to recognize that getting input from these 3 categories of people heavily impacted the direction our knowledge translation went. Without the perspective of the care providers, we wouldn't have known which aspects of the post-transplant management to slip into the story, and wouldn't have heard the outside perspectives on the interactions between parents and patients as patients progress to adulthood. Without the perspectives of the parents, we wouldn't have known that in day-to-day life, teens had trouble appreciating the bigger picture. Without the perspectives of the teens, our target audience, we might have developed something blunt and boring about persevering through the side effects of medications when those issues were hardly on their radar. So now that the graphic novel has been printed, early feedback from peers and assessors of the project has been very positive. This summer, we were able to send the story out to dozens of teens, post-transplant patients living in Canada, and we're excitedly waiting for their feedback and the feedback of their healthy siblings, actually, to see if it's interesting and encouraging for them too. We're also considering pursuing longer-term evaluations to see if the graphic novel could cause any long-term improvements in adherence to post-transplant lifestyle guidelines. Now, I want to again thank my co-authors, as well as to acknowledge funding from the Undergraduate Research Initiative and the Strawberry Children's Hospital Foundation, and also that the U of A Painting Department graciously provided us with a studio for that summer. Now, as far as we know, this is the first graphic novel for transplanted teenagers, and we really hope that its subtlety and content can make a difference in their lives. We also hope that the success of this project could encourage other patient-focused art medicine collaborations maybe spark some creative out-of-the-box ideas in more areas of research. Thank you very much for listening. It was a pleasure sharing this project with you all.